Social Work Career Panel. So excited you all can be here. My name is Olivia Scott. I work in the Lockheed Martin Career Development Center, and we're partnering with the School of Social Work to put on this event for you. So we're going to go ahead and get started. We have some panel questions that we're going to ask our panelists. We have time for our panel, for y'all to ask questions to them as well. So if you think of something, write it down, remember it. There will be time for that. We're going to do an overview of the social work program, a little kind of blurb about the Career Center and what kind of services we can offer to you as students, and then we'll send you on your way. So let's go ahead and get started. First, we're going to have the panelists introduce themselves.
I'm Stacy Lewis. I'm an LCSW with Lingo.
And I'm Carnisha Collins. I'm an LCSW and an LCPC with the Arlington Police Department.
And you can take them out if y'all just want to hand them between each other. Yeah.
I'm Cindy Ward. I work with the Arlington ISD.
I'm Renata Koya. I work with the John Peter Smith Hospital.
All right, so to get started right away, our first panelist question is how and why you chose social work.
Okay, I'll go first. So this is going to be, you all will probably laugh at this. How many of you have seen the movie Losing Isaiah? Anybody? That's why I chose social work.
I actually feel like the profession of social work chose me. And I say that because as a young kiddo, I remember wanting to be a help to others. Even in high school, people would turn to me for questions and insight and what would you do in this type of situation? And when you see a person kind of follow through with what your advice is and it actually worked out to be a positive impact, that makes you feel good. And so that's why I chose social work. I didn't know at the time that it was a profession, but I learned later on there's an actual profession that is in the helping field, and it actually helps you be a little bit more insightful for others.
Well, mine is kind of the same thing. I did have experiences where people would come to me and you know, I could at least listen, but then sometimes I would try to help out, and they would, a few months later they'd come back and say, remember when you told me this? And I was like, no, but I'm glad it was helpful. So that happened enough that I felt like maybe, you know, that would be something that I would be good at. So plus I enjoy both psychology, but I also was interested in policy and how to build communities and how to advocate for people's rights. And I think as I learned more about the field of social work, it combines those two. You can work both with individuals, working with them, but then also advocate for them on a macro level. So I really like that about social work.
I was not, early in my first few years of college, I did not know what social work was. I actually got my bachelor's in psychology, and when that was completed, it's a music I knew that I've always wanted to keep going, or is that disruptive for you guys to hear me? Okay.
If y'all could be a little bit louder, it's a little bit hard to hear on this side.
I've always been interested in helping people heal emotionally. I knew that was an ultimate goal of mine, to be able to help people in that area. And I got my bachelor's in psychology, and when I was done with that, I was looking around and saying, okay, so what's next? What do I need to do next in order to be able to reach that goal of mine? It's kind of when I stumbled into social work and learned the, such large different amount of ways that you can utilize that degree. That's kind of what led me to choosing social work.
All right, so our next question is kind of a double question. So you introduced yourselves and told us all where you work, but elaborate a little on where you work and what you do as a social worker within that context.
So at John Peter Smith Hospital, it's a county hospital in Tarrant County, they have a psychiatric department, and social workers in their psychiatric departments utilizing a variety of different levels of care. So in each level of care, social workers play a different role. So for example, in our psychiatric ER, social workers have a really neat role where they see patients oftentimes before the physician even sees them, and does a full evaluation, make a suggestion for a diagnosis for that person who's come in for a psychiatric evaluation, makes a recommendation for a level of care, and then the physician would see that patient after you and kind of either agree or disagree for that level of care. So that's the starting point then at the ER. I'm a floater in their Department of Psychiatry, so I get to see all of the different levels. So if someone goes inpatient, for example, my role there would be to provide case management in group therapy while the patients are there in their inpatient psychiatric facility. Social workers are also utilizing that setting on their outpatient clinics for therapy. So they go in to see a therapist once a week, or there are different programs in place as well, called like PHP or IOP, which is a little bit more intensive a therapy program that's available in their psychiatric facility.
So through the school district, I work specifically with the Families in Transition program, which is the program that provides services based on the McKinney-Vento Act. It is an outreach program for families who are considered homeless underneath the McKinney-Vento Act, and so we work with those families, and we also work with the students who are considered unaccompanied youth, and so those are the students who for whatever reason are not living with their biological parent or legal guardian at the time. So the goal is to try to support them through their transitional living situation, try to help them find a more stable place, but obviously since we're through the school district, we want to make sure that they're continuing to succeed in school. And so, we try to provide whatever services we can to, whatever resources and referrals we can to help them, that they need in order to succeed in school. Through the school district, there are also social workers who work with our pregnant and parenting teams, both male and female. We also have social workers who are designated to work for students and with families who have a concern about substance use or abuse, and those are our intervention specialists. We also have some social workers in some of our specialized schools. For example, our newcomer school has, she's called an immigration specialist, but she is a social worker to help students deal with their transitional situation as well, but also some of the trauma that's involved with some of the things they've gone through to get to this country. So there are a number of different areas that we work that are available through the school district to work for social work.
So I have two jobs. I work at John Peter Smith Hospital as a case manager in the main hospital, not the psychiatric area. And I work for the Arlington Police Department as a director for the Victim Services Program. And to reference the medical side, you're acting as a social worker, but it's a totally different aspect of social work when you're working at the police department. So for medical, you're looking at safety and what is going to optimize that person's service delivery when they're discharging. and you are the go-to, you're heavily dependent on in the hospital to ensure that there's a safe discharge plan. And that can go from being homeless to not being able to afford medication to needing some type of medical device in order to optimize your daily living. Now at the police department, my social workers, when they are out in the field, they respond to crisis from a law enforcement call, and that is a victim of any crime. Most people think it's just domestics, but it's robbery, sexual assault, burglaries, any type of victim of a crime. My staff go out and respond to it. We also developed a program for staff members to go on what we consider acute cases. And so when we do our scanning in the morning, we determine what cases are the most acute. And so it takes that brain of a social worker to truly assess the situation to determine what the acuity level is in order to come up with the action plan to respond. And so we call that our Project RAISE, and we go out with a law enforcement officer and conduct home visits to ensure that whatever caused us to be involved in the first place, that risk has been reduced.
So at Lena Pope, I've been there going on 15 years and have worked in a variety of different programs. Right now, I'm the director for counseling services. We have 5 counseling offices in the DFW area. And we provide counseling services, therapeutic services for children as young as 3 years old, all the way up to, I think one of our clients is probably like 81 at this point, but usually a lot of grandparents that are helping to raise their grandchildren, and so it's transition types of situations. We get self-referrals from folks that are needing counseling services. We work with the Department of Family and Protective Services for families who their children have been removed or either in foster care or also maybe in a family-based placement. We work with children, adolescents that are in the juvenile justice system, as well as adults that are in the parole system, maybe on probation or parole for any crime. We do substance use treatment services, and we do all of those things through individual, family counseling, group counseling, or couples counseling. We have several specialized programmings. One specifically is called Project Safer, and it is for children and youth, so ages 6 to 14 that have problematic sexual behaviors, and these are not kids that are going to be adjudicated in the juvenile system for a sex crime. These are kids that are acting out sexually with their siblings or maybe with their peer group or other family members, but they're too young to be in the juvenile system, so they're referred for services, intervention services, hopefully to keep them from going further, or once they get to the age of 10 or up, once they can be adjudicated for that specific crime, to keep them from going further into that system.
All right, so our next question is, why do you find your work rewarding?
I find my work rewarding. These ladies talked about this at the very beginning. You're able to help people. People are not coming to us because it's fun. So people are dealing with really intense emotional situations, things that have, traumatic events that have followed them through their life that they maybe did not deal with early on. Same with their children. It could be for any purpose. But we're able to help people to find an outcome, a way to cope with whatever's going on. My belief is that 90% or more of the population is dealing with some kind of traumatic event. And so not everybody, you don't always know how to deal with it. And so if we're able to help some folks put into place a way to deal with it or just become educated about what they're dealing with, then we're able to do our jobs. I've had several young ladies, they're moms now, but I worked with them when they were teenagers it was called the Unhooked program at the time, and I've run into them in Target, the grocery store, and they're like, thank you. And at the time you don't know that you actually helped somebody. It's usually years later when you find out that you actually made an impact on somebody, and so it's pretty fantastic to have somebody walk up to you in Target and say, do you remember me? I was so-and-so from this time, and I'm an attorney now, and, you know, and they're doing great, so it could really help.
I'm basically going to duplicate that answer, but kind of give you examples of why and how you can actually see things come full circle and see it truly come into fruition. I worked for Child Protective Services for nearly 10 years, and that job can be daunting. I became a supervisor, so I was no longer a case manager, but as a supervisor, you basically see everything, not just a little caseload that you're seeing. And so it's really rewarding when even though you may end up having to remove a child and essentially split a family up, you are able to see in the end the positive impact of your work. And so I actually, now that I'm no longer there, I've been gone for about 5 years now, and I actually people find me on Facebook and they message me and say, do you remember me? One of the things that I have passion about is substance use. And so that was one of the things that I managed my entire career there. And so unfortunately, the people that are reaching out now are just now getting sober, but they remember me from when I was the supervisor of the unit. And I had a young lady probably about 4 months ago to reach out. Did not remember her dynamics, but she totally remembered me and me holding her accountable for the substance use and helping to help her navigate the system through CPS. That's rewarding when you get those type of callbacks and not someone screaming and yelling at you.
Well, I guess I want to echo them. I wholeheartedly believe it's, when I get out of it most, it's just working with the students. I really enjoy, I work at a particular high school, so sometimes I do get to see students, you know, maturing from freshman year on to sophomore, or on to senior year. And just on the way here, I saw one of my students who's a senior now, leaving for lunch. And this is a young lady who she's from a large family, and due to how large the family is, they have been in and out of the homeless situations for probably since she was a sophomore. And there have been times where she has not come to school for large portions of time due to the homelessness, but also because she needed to help take care of some of the younger siblings. She's one of the older kids in that large family. So there were some huge gaps in her schooling, and she has worked real hard and over the summer, and she is on track where she's supposed to graduate at the end of the year with her cohorts, and she has worked incredibly hard for that. And as of this year, she's not living with her family because they're still kind of having difficulty getting stabilized, but she's found a place that's close to school. She's joined the track team. She's kind of doing everything she's always wanted to be able to do as a student because she knows it's her senior year. And I saw her walking off to go get something for lunch, and she threw a blanket around her to stay warm with her friend. She had a friend, which sometimes is difficult to have when you're moving around so much, but she had a friend she was talking with, and she had a huge smile on her face, and just seeing that change in her just made me feel great. So that's the sort of thing that really does make you feel good about what profession you chose.
It's very rewarding in so many different ways. In a psychiatric facility, ER, for example, you know, everybody kind of comes in at their worst. They're crisis, they're hearing voices, so they're hallucinating, they may be under the influence, they may be suicidal, and so just to kind of see them stabilize through medication and have therapy be available to them, And for the first time, they get to open up to other people and talk about what their struggles are, what their fears are, and put together a plan to stay safe, put together a plan for what they want their recovery to look like, to watch that process from, that person who walks in the door in crisis to that person who's now discharging and going home and have now learned some healthier ways to cope with their trauma and whatever it is that they're struggling with is very rewarding. Unfortunately, it doesn't always fix everything the moment they walk out of that door. Oftentimes we see a lot of the same people kind of come back in, but at least, them knowing that we're always there if this were to ever happen again. Kind of watch them learn each time a little bit more is very helpful. It's very rewarding to see that difference.
All right, kind of the flip side of that question, what aspects of your work do you find the most challenging?
I would say, it's very draining for us as professionals to hear some of these stories that we have people come and tell us. So in our profession, it's strongly encouraged that we are always doing things to take care of ourselves. So self-care is very important. Whatever it is that you find that is helpful for you, right? To take care of you, because it can, while it's very rewarding, as we all kind of talked a little bit about that, it can also be very difficult on us emotionally. So making sure that we're taking good care of ourselves is very important thing for us to put in place.
That's true, that it can be kind of draining to work through some of our clients' issues. But I think also working at the school district, social workers are, the school is kind of a host environment, and so it's not necessarily a social service environment. So they have a goal that is specific to them, which is graduate students, and they have certain tasks that they have to get through and certain expectations to be able to get a client or a student through that. And sometimes working with the clients that I work with, or maybe the pregnant and parenting counselor works with, you have to be able to educate them a little bit without telling them about the student's specific issues, but educate them a little bit and talk to them about what stress might look like, what anxiety might look like, depression, and how they can maybe support that student as we're working through some of those issues. And I think sometimes I think that's the most difficult part about working in a host environment where it's not necessarily a social service environment to begin with.
So I work at the police department, and that's definitely challenging to be a social service entity, working in a police department where they enforce the law. I can say though, since I've been there, we've made great strides to collaborate and ensure that we're infusing even if we're on scene and stopping someone for a crisis, that we have an element of compassion. Because a lot of people think that police officers are mean and they're there just to arrest you kind of thing. While if you broke the law, you probably are going to get arrested. There is an element of compassion, and I think our team brings that there. But it is challenging when you're kind of faced with the social side and trying to integrate it into a police department and help them understand the importance of exhibiting that compassion when they're on a stop.
So the way that both counseling services are set up, we're set up kind of in a community-based center, so folks can come in off the street and request services. You can be referred by law enforcement or school system or doctor, and you can come in any type of way. But the most challenging thing that I think that really kind of resonates is that sometimes the services maybe don't work the first time, and so folks have to come back. Sometimes, and I think probably what really stands out most in my mind, just because I'm thinking back even to one of my very first jobs working in a residential treatment facility for young men, adolescent boys, is that if you're working with kids specifically, they always have a family to go back to, and sometimes the family does not embrace what that child or that adolescent may be required to do by a court system or even what they need to do. And so we get a lot of younger kiddos that are in custody disputes between their parents or their caregivers. And what I tell people is that you really have to love your child more than you can't stand each other or you dislike each other or even hate in some senses. And people don't really get that, because what you're doing is you are perpetuating that cycle when you continue to fight, or if there's domestic violence or whatever the cycle is of pain and hurt in the family system. If you're doing that in front of that child, then it just continues that system, and they could possibly grow up to do the same types of same types of behaviors, or have other issues that are triggered because of the violence or the mental health issues or substance abuse issues that are exhibited to them. And so sometimes those things don't always work, and the outcome's not always great. And self-care is a big piece of it, because you can't help everybody. Not everybody wants to be helped, and sometimes you have to just let the dice kind of fall as they do, as they may. And so sometimes that doesn't always feel really great. But then I think when people come back again and say, okay, this didn't work, but I want to try this way this time. So sometimes you get a second chance and sometimes you don't, but I think you have to know that going in, that you're not going to be able to help everybody every single time, and you may not get immediate results. It may take years, or many years, especially for adults, when they come back and say, okay, I do remember that, and and it's 10 years later or whatever. So I think those things are hard to learn, but you just have to keep that in the back of your mind, because sometimes
All right, so our next question is, how did your field experience prepare you for your career?
So when you're choosing field placements, I feel like I didn't have a scenario like you're getting to experience today, where somebody, where people were brought in from the profession, from the field, that are currently doing the work, to hear stories. Like I said, I was watching the movie Losing Isaiah. I said, that's why I want to be helping people, because I've also always been a helper, but I didn't realize that that's what I was. I started out in psychology and criminal justice background, and it wasn't quite the fit for me, and so I had to do a lot of homework, a lot of research, and ask a lot of questions. So if you're not getting the answer that you're looking for, or it doesn't seem right to you, just keep asking questions, be persistent. And then once you're in your placement, if you are not, if it's not meeting your expectations, or it's not exactly what you envisioned that it would be, talk to your field supervisor, talk to your professors, and ask them, is this what this should look like? And if there's something in addition that you want, ask for that. There's nothing wrong with asking for what you want. They can say no, but my grandmother always said, closed mouths don't get fed. So if you don't speak up, you're not going to find out if you can do that or not. And just be open to anything, because you never know what you may end up liking, the thing that you didn't think you were going to like.
So the internship experience can be very interesting depending on where you go, whether you selected or you were late and you ended up chose to go somewhere. So I think that, for me in particular, the way my experience went, I was already a professional. I was working for Child Protective Services already, so I had a professional background. I initially started with an organization that focused on mental health, and it was a really small organization that needed staff. And so as far as it preparing me for this particular field, I can't honestly tell you that it truly prepared me because of the dynamics. They depended on interns. And so with that, I encourage you, if you ever end up in that situation, whether you're already a professional or not, you go to your field supervisor and you talk to them about what it is that, what should this experience look like, or you speak with your liaison. Quitting is not an option. I don't recommend that, because you want to definitely navigate through something that you feel may be not really that advantageous, because in the end, you're going to find that experience probably will overlap somewhere in your career. My second experience actually did help prepare me for what I'm doing now. Our law enforcement officers are going out in the field, and they are seeing mental health patients where they end up having to, what we call an emergency detention. They ED them, and we're able to give insight. I'm able to give insight to them from my experience as a social worker that worked in the psychiatric area. I worked at Springwood. And so I was able to give a lot more insight and give experience so that they can kind of help that person versus put them in the back of the car and take them in. And so they were a little bit more compassionate.
What was the question again?
How did your field experience prepare you?
The field experience, yeah. I was extremely lucky. I had 2 years of 2 different field placements at the university I went to. And the first year was not the best, but I hung in there, and I did learn what a case manager did in a social service agency. My second year was in a school, and I knew by then that I did want to be specifically a school social worker. And so with that placement, I was able to, they gave me a couple of schools to go to, and they paired me with another social worker. And so I got, experience doing individual and group work in the school setting. And so both with regular ed students and special needs students. And so I really felt like they really valued the social work interns and were trying to make it the best possible internship for their interns. So I was extremely lucky, and I felt like it prepared me quite well.
I have to agree with Sandy. I also had really good field experience, both placements. One of them with the homeless population, where I learned so much, and another one at a probate court for adults who don't have capacity, so they're under guardianship. They have both prepared me in many different ways. They were very open to allowing me to choose kind of what I wanted to learn about. I had really good supervisors that sat down with me and gave formal supervision weekly, and so I had a really good experience. Oftentimes, sometimes you're not doing exactly what you wish to be doing in that field placement, but as long as you communicate, we actually had a conversation about this downstairs before heading over here. As long as you're, you advocate for yourself and say, yeah, I would love to I'm here to help you guys, just like you guys. I am here to learn, so I would love to help you in this way. But I'm also curious about this. Can we maybe allocate some time where I get to learn more about this within your agency? So being open. And advocating for myself and kind of sharing with them what it is that I was hoping to get out of the field experience, I think was very helpful in making it a successful field experience.
All right, so for someone who's considering this field of study and this kind of work, what's the best advice that you could give them?
I would say keep an open mind, try everything. You just don't ever know the experience that you might get if you, go and do a field placement at, or even an entry-level job with, say, a prison system or a school district or community counseling or in geriatrics. I mean, you just don't ever know. And I said, I don't want to be doing, I'm not interested in working with older people in the geriatric field, but I want to work in the prison population. Well, it wasn't what I was supposed to be doing. So really evaluate and try all of it. Try all different types of placements, jobs. And early on, if you were able to kind of maneuver around and maybe try different positions in a organization or in an agency, do that if you have the opportunity to do that. But don't stay open-minded and keep your options open.
I'm going to somewhat mirror what Stacy is saying. Like I said earlier, my first internship wasn't, it was pretty interesting and it wasn't what I expected, but I did learn some things from it. If you are considering this role, I commend you because it's certainly a role to, it's laced with ups and downs, kind of like a roller coaster. But if you have the compassion and the heart to actually help people, you definitely will stay the course. If I feel if you truly want to be a social worker, by the time you get in your first placement, you will absolutely know. Doesn't matter where you go, you will absolutely know whether or not you can sustain as a social worker, because you're going to meet negativity, and if you run into that, that's your chance to demonstrate how you can adapt and how you can maneuver through something that may be considered adversary. And so I strongly encourage you, if you get into a field placement that you just absolutely do not like, you think about it before you try and pull the plug. It's very important that you stay the course, because you never know how something's going to overlap in the future in your career. The initial the initial internship that I was in, I'm actually about to implement what we call Project WRAP. It's a wellness recovery action plan for mental health. And so while we're victim services, we're also going into the lane of mental health. So we're going to implement something that I learned long ago in an internship where I thought I just didn't like, but I'm glad I stayed the course.
I would add to that in that, if you're considering it and you're wondering if you want to work with a certain population, find a place that you can volunteer and see if once you're in that setting, see what actually goes on in that setting, if it be a hospital or if it's a school, a social service agency probably has some places that they might be able to get volunteers. But see what it's like being in that sort of institution, and once you, if you can find a social worker in an institution, I can guarantee you they will be interested in talking to you about what their job is like and what the good parts of it are and what the bad parts of it are, and talk with you about it. So I'd say, think about volunteering someplace too.
I'm thinking more like after school. So when you're done with your master's program, if you're thinking about, I know within a hospital system, I'm not sure if the lady can answer for their departments, but within the hospital system, your license is very important. So, oftentimes, I know when I was going to school and getting my master's in social work, I didn't understand how important getting my license after I graduated was. And in the hospital system, you won't be hired without a license, so that's definitely something to keep in mind.
All right, so that's all the questions that we have prepared. So now we're going to open it up to y'all's questions. Do you think we can speak up, or do you want me to walk around with the microphone? Okay, perfect. All right. Questions?
First of all, ladies, I just want to thank you for all attending this and making time for this. I just want to share with you too, this is not easy for me to do, but I've been a patient of JPS Psychiatric Services. I would not be pursuing my master's in social work without that service, so thank you. You've educated me, you empowered me. Thank you. And ma'am, my question is for you. Now, you brought up that one, yes ma'am. You brought up that one of your roles as a medical social worker in a general hospital. You also brought up that it's your role as a social worker to safely discharge your patients. My question to you is, do you ever feel pressure from insurance companies or from doctors to discharge a patient? And if so, in your opinion, it's unsafe to do so, how do you handle that?
Right on. I've been doing this line of work for about 12 years, 14 technically, but about 12 officially. And I'm certainly not a pushover. But you do get that pressure. You get that, the sense that the doctor is trying to go ahead and discharge a patient because there's no more days that are covered, or they're right on the cusp of not being covered. And if it's a situation in a medical side, if it's unsafe, I'm going to document in a chart it's unsafe. You won't find a doctor that will discharge a patient after a social worker has said that in a note.
Okay,
So the answer is they won't discharge.
thank you.
So again, I'm on the end here. I'm curious. I am my passion is criminal justice reform. Looking at it in a little bit different perspective, maybe than at the police department, but perhaps more so at the Leopold, where you do the probationary work and what have you, and rehabilitation programs that need to be furthered and probably expanded to better help our inmate victim populations. So I'm curious, in your substance abuse specialties, what did you study? How did you go about acquiring that? Did you minor in that? Any advice on that would be greatly appreciated.
So I come from a family background of substance use, and so, like I mentioned, the Lucy Isaiah movie, that hit home with me, and so I knew that I needed to find something that was going to touch on that. And so one of the things that I did was, and at that time, I'm originally from the state of Missouri, and the city of Independence at that time was the capital of meth manufacturing at that time. And so through my whole graduate program, I focused on substance use. My minor in my undergraduate programming was criminal justice and corrections, and so I took criminal CJ courses, but then I also took mental health, actually psychology, with a kind of a strong suit more in substances and learning about the drugs. And so if you know anything about substance use in our nation, things change all the time. And there's new drugs that come out and new formularies and all these things, and then you have your prescription level types of medications that people are addicted to. And so I just focused on that kind of, because I think, in my opinion, and you all may agree, that probably 85% of the time there's some type of co-occurring disorder that's in place. So I think it's incumbent on anybody that's going to look at this type of profession and knowing both sides, because usually there's some type of substance use somewhere in the mix somewhere. And so know your substance use.
Yeah, I saw a study, I think recently, that, and I may be wrong, and you will probably be able to correct me, that the percentage, they conducted a study on inmates at the point of arrest, at the point of booking. And I want to say it was upwards of 80 to 85% of those individuals tested positive for some type of illegal substance, other than alcohol or what have you. So I think a driving force within our overpopulated prisons today is the fact that we are not addressing the substance abuse problems that are still rampant in the prisons. So that's my curiosity, and I know UT Arlington is developing a substance abuse minor program, so I just wanted.
That's fantastic, and that's great. They should, because you need that piece of it, because like I said, you're going to be dealing with it, I think, regardless of what area you go into. The part where, when you're trying to advocate for funding, for services, for all those things, it ends up being really political. And so I won't go into any of that, but that's where you really need to be able to know your legislative pieces and know about the acts and the laws that impact the services that are provided, whether they're provided through a state block grant through the federal government or through just a local grant funding source through a foundation that's in your area. Know how those pieces impact, because when your state legislature is in session, they always have, somebody's always bringing something up either to add or to cut. And so in my experience, they cut a lot more than they add. And so you have to just constantly be advocating for funding. And if you're in a position where you can have a voice in that process, if you get asked, how does this impact your work, be able to say, hey, because of this cut, this is what happened to our programming, or we're not able to provide services because, like the Affordable Care Act, they added a bunch of language into that act that said, you have to provide substance abuse benefits, but if you have insurance and you can't afford your copay and you can't afford your deductible, guess what? There's not anybody to help you with that, because the state block grants make you bill those insurance pieces first, but if you can't even afford to use your insurance, where are you going to go next? And so we run into that a lot. We just know what your laws are around and how it impacts, and get involved in NASW and other advocacy programs, because they'll educate you at the same time, giving you options and places to advocate in place for.
You meant for me, correct?
Yeah, I just was curious, your perspective working with the police department, what a difficult job you have, I'm sure. Great people on both sides of the equation, but bravo. So on the substance abuse side of things within the police department environment, because legal obstacles, I think, are our greatest problem right now in trying to alleviate some of the legislation and turn it for the better. So I'm just curious your perspective.
So to answer your initial question, I kind of got tossed into the substance abuse role at CPS. Which, you have several ancillary duties as a supervisor, and there was a course called, we were running a program called Roads Recovery, offering alternatives to drugs, and it initially didn't intrigue me because I was actually kind of voluntold to manage that program, but I learned a lot about substances, which triggered me to go ahead and learn more. So I did a lot of research, because in order to manage a program, you need to kind of be up to par. And eventually I went and got my chemical dependency. Yeah, it's a low battery. So I went and got my chemical dependency counselor license. Because of that, in addition to my second internship, I worked in a partial hospitalization program where, as an intern, you have to basically get in there and do the same type of work that the workers do. And so I like that work. I like that it goes hand in hand. And Stacy said, you're going to have people with dual diagnosis, and you can't treat mental health before managing that substance issue. So, did I answer your question about?
Yeah, how long did it take you to acquire the chemical dependency licensing?
So it just that was me, okay? It doesn't take long, so long as you have your master's degree as a social worker. But once I got my master's and my clinical license, I was pooped. And so I just waited a while before I acquired it. But basically, you qualify once you get your master's degree and you submit a document in, but you do have to know, you can't go in and take the test if you don't have the knowledge base. So the knowledge base that I gained from Child Protective Services and learning and doing the research in addition to the experience I had helped prepare me for being able to pass that exam. It actually is a little bit tougher than the clinical social work exam.
I'm currently going through, this is for young women as well, a situation where I have somebody who's abusing substances and I'm trying to get them help without health insurance. And so I know I did reach out to, I believe it was Lena Pope, and a couple other programs that go through the DSHS with the state funding. What do you do in a circumstance as a counselor or as a program manager where you see, it kind of goes hand in hand with this as well, people who are wanting help and they're reaching out for the help, but it's taking 4 to 6 weeks until they can get that proper help that they need because there's such a demand for this that's going on. And then it could be leading to criminal, activity and so on and so forth. Are there any other alternatives that we can step in the meantime until that help is available? Or what direction do you typically point people that are on that waiting list of these programs?
So if you, well, an initial thing that needs to be asked is, does it need to be inpatient or outpatient? If it needs to be inpatient, then they can kind of step back and go to the locations that are screened for those, Pine Street, Billy Gregory, those are both in Fort Worth. But if it's an outpatient thing and they haven't used in a period of time, and I'm talking like, several days to a couple of weeks kind of thing, because you want them to stop using. Some folks say, I'm not going to stop using until I walk in and sit down in a seat, and sometimes they don't even do it then. But if it's outpatient, then we usually will say, if you are not a part of a Narcotics Anonymous or Alcoholics Anonymous group, go to one of those, and that's if they're not using, because we don't want folks going to those groups if they're using because it triggers other people. But any kind of support group, if they've got other folks that they can be talking to, but if they're, I'm talking hardcore drug, I'm talking heroin, methamphetamine, cocaine, crack cocaine. If they're using those and it needs to be an inpatient type of setting, then it all has to do with beds. So it's where's their bed available? Is to find somebody that will help you navigate through that. So and they should, if they're DSHS funded, then that intake coordinator or the person that's taking that call for the referral should be able to help them figure out who, if anybody, does have a bed. And so at that point, if you can get in and they're able to do that, then that's what you want. And if they're not, which that happens on a really regular basis, and that goes back to your question, because there's not enough beds in Tarrant County or in the Dallas-Fort Worth area. Now, if you have private insurance and you can go to, some place where you're going to spend $10,000 a day, well, you have a bit, you can probably get into there. But those are legislative issues, and it always goes back to money. But try to get them into some type of support group, someplace where people are going to be supportive of their effort to stop.
So, drugs are tricky, depending on which drugs a person is using. And so, there's no cookie cut response to this answer, and I say this wholeheartedly because I am very, very passionate about chemical dependency. And so you don't want to give someone the wrong answer when it comes to substances, especially, as you said, heroin and alcohol. Those two drugs could seriously kill someone, especially if you say, don't use. That's not a good answer to someone who's actually addicted to one of those drugs. And so the recommendation would be, especially if they're not funded, you would recommend that they go, you can determine their symptoms. If they're demonstrating some kind of psychosis because it's induced by substances, then you can go and get them psychiatric care, and they're going to find out that there's an underlying issue for substances. And so that's a way you can kind of backdoor your way into it. But if there's a situation where marijuana or something that's not really highly acute and there's no real symptoms attached to it, then you probably aren't gonna get immediate help. And so you just wanna be, you know, as a social worker, that's why when Stacy say, it's very important that you learn about substances, because you need to be able to articulate yourself when you get a patient, when you're trying to do a referral, and you can give symptoms, and then once you give the symptoms, you can get them into a facility for their symptoms. And so if a person is demonstrating delusions and paranoia or command hallucinations, but it's substance induced, you can leave that off the table until they get in. And then they'll learn that this individual is using drugs. Because unfortunately, providers, they're not as sensitive to substances because they think it's a choice as they are a person who's having a mental health crisis. You are having a mental health crisis, it's just induced by substances. So you just have to be kind of crafty with how you get a person in to a treatment facility. Because I'll tell you, a place like a Millwood or standalone site facility, they are mandated by law if someone comes in and they're imminent, they cannot turn them away unless they don't have a bed, and then they have to transfer.
So curveball a little bit with that, so if somebody's been sober for a couple of years.
I can't hear you, I'm sorry.
It's okay, there's no more, okay, I'll yell. If somebody's been sober for a good amount of time and then alcohol is what I'm experiencing has been, it's becoming an excessive abuse. She's abusing alcohol really heavily again, and now it's going backwards with wanting to, she's been sober from heroin. So it's one of those situations where it's like she's reaching out for help and she's recognizing, and I'm trying to help get in, but it's these 4 to 6 week waits, and I'm trying, you know what I mean? It's like, and trying to prevent the use of the illegal drugs and the illegal stuff that's going on. It's so exhausting. And I don't know, it's just looking for any answers possible. I mean, I don't know how you guys do it. You know,
So you look, can y'all hear me?
Yeah.
I'm from Arkansas. So with that type situation, it goes back to your assessment skills.
Okay.
You're assessing the symptoms. Yes, this person does need substance abuse treatment, but what you're looking at is the symptoms. And so if they're having decompensation, they're not able to participate in their daily living activities, those things can be integrated into psychiatric issues. And so once you can demonstrate imminent symptoms, you can get someone some help. I say that to kind of empower you as if you're planning on becoming social workers, you're going to have to come up with great plans and solutions to be able to assist people. It's about the knowledge and how you manage that type situation. It used to happen all of the time, especially at CPS. Unfortunately, a lot of those people didn't have insurance, but I'm calling about these symptoms that I see, not that I know that they were on heroin or some other opiate. These are the symptoms. Do you have a bed? Right? Okay.
What about just if in detoxing situations or when they've actually fallen off the wagon again and they're full blown? What about the emergency room? What are your options about just going there?
So the emergency room is utilized we call those high utilizers. And that is something, if a person walks in the door on alcohol and they're detoxing, what they look at is before a person gets to what they call DTs. And if a person is not going through delirium, they'll discharge them really quickly and say, go drink, seriously. But in a situation where a person is already actively going through withdrawal, they have to admit. So it just kind of depends. That's why I'm kind of trying to empower you guys to know what those symptoms look like so that you can assist your victims, your clients, whenever they have these type situations. So you get right on the cusp of DTs and let's go. They cannot discharge.
Do you want to elaborate on that? I saw you nodding.
Yeah, I was just thinking, yeah, those were all great tips, but also whenever, patients don't have insurance and you kind of just don't know where to go, JPS does have what they call JPS Connection, which is a really great benefit that gives people access not only to the mental health side of things, but also the medical side of the hospital. So with the JPS connection, you can, see a psychiatrist, get medications, seek therapy there, but you also have that medical benefit as well. In case you guys do come across somebody who's looking for these services but don't have insurance, they'll have the means to pay for them. That's one option.
You said it was called JPS Connections?
JPS Connections, that's correct.
Let me make sure we clarify that though. JPS Connect only goes within that network. So I don't want you guys to leave here thinking that you can take JPS Connect outside of the network of JPS and get any assistance from them.
Yeah, it's within JPS network, correct, sorry.
All right, we're gonna do one more question and then we're gonna move on. So go ahead and ask.
Yeah, well, I think this is just relevant to bring up just by something the subjects that come up. We just addressed the JPS connection. As you said, JPS connection, that is for Tarrant County only. Here in Dallas County, Parkland Hospital has their own county collegiate program. With that being said, I'm going to make this really quick. I know I'm not supposed to talk about politics, and I'm not. I'm just going to talk about something like ballot right now. There's $800 million bond for Tarrant County to expand JPS and to expand not only their mental health services, but to expand their health network and clinics all throughout Tarrant County. And it's desperately needed because of the population growth here in Tarrant County. So I urge you to vote yes on that. It's on the ballot, and it's over a 10-year period. So I say $800 million. The number is not that staggering. It's already been supported by the county, and it's up to the voters, and it's not going to increase sales tax. I'm just going to toss that out there.
All right, so let's go ahead and give a round of applause to our panelists. All right, so our next little piece here is Antoine Williams is going to talk about UTA's social work program. So I'm going to go ahead and give the floor over to him.
I'll just be real brief, try to be real brief, this will work. Thank you again. On behalf of Dean Ryan, thank you for coming and thank you for joining the panel, I really appreciate it. Again, I'm Antoine Williams. Can you hear me? I oversee communications, community outreach, admissions, and recruiting for the School of Social Work. I want to talk to you a little bit about our school. Some of you are not students here, so we just want to tell you a little bit about our programs and our school. This down here so you can kind of see. Part of it, of course, this is our mission. One of the things I wanted to also mention, we do this panel every semester. I think the last semester in the spring, we also had a military social worker, because I'm a retired officer, only officer. And we have a lot of veterans, military veterans in our School of Social Work. More than 16% of our students are military veterans, so it's a large population for our school. We have a lot of our faculty members who do research in a variety of areas, and I know many of you, if you're already students, you're taking classes with them, or you will, in the master's program particularly. We have a lot of expertise in a lot of areas: military social work, immigration, refugee, women's and gender care services, Native American, Indian care services, community administrative practice, a lot of areas for you to look at and to understand. A lot of what the panel was talking about today, learning about the different aspects of social work. So hopefully you'll have that opportunity in different classes, but if not, the volunteer work, the field placements, that gives you that vast experience so you can decide what you want to do in your career or where you want to go. A little bit about, I'm going to brag a little bit about our school. Excuse me. We were just last month ranked #1 by bestmswprograms.com for our online master's program. And they looked at affordability and the specialties that we offer. So we offer a lot of specialties. We are the largest school of social work in the state of Texas. So that gives us an opportunity to offer more courses, classes, specialties at our MSW level. And then, of course, those same professors that are teaching at the MSW level, many of them are teaching at our BSW level as well. Someone mentioned the substance use treatment minor. That started this semester. So we have this substance use treatment minor that's open to all university students. We definitely encourage the BSW students to look at taking that substance use treatment minor. When you also get your field placement, those hours will be, you get a field placement in a particular area where you can use those hours toward your LCD. We also The biggie one here, U.S. News and World Report, we're in the top 15% of schools of social work in the country, and that's number 34, ranked out of 251 schools. So that's a big thing, and we just moved up 4 spaces. So really top program that you're a part of if you're in the school or if you're looking at joining. Veteran friendliness, I mentioned that already. We're number 1 in Texas for military veteran friendliness, and number 5 in the nation. And they looked at 368 schools of social work programs. These are some of the areas. Sometimes I do this also in my class. I'm an adjunct professor. I teach the social welfare policy class, 3303. And I try to talk to them about all the different areas that you can do in social work. The students come, and some of them are BSW students, some of them are not yet, and they don't realize all the different things you can do. I'm glad you're with the police department. We've been talking about that a lot. We just published a story about Kimberly Parker. She's a ULIS police officer and an MSW graduate of our program. And so she does similar programs with ULIS Police Department. But she also does, I'm not sure if you do that, or I was going to ask you about that, she does PTSD services for the police officers through dealing with them and some of their issues they're dealing with as part of their job. But there's a lot of areas. I mentioned school social workers. There's another area that's really emerging, starting to expand a lot, and that's social workers working with athletics. So if you're interested in sports, there's social workers now working on college sports teams, professional teams. They're now hiring social workers to work with the athletes, their families, and provide that type of service. We're also seeing more social workers being hired by corporations like IBM, AT&T. Those companies are starting to understand the benefit of having a licensed social worker working for their corporate company and working with their employees, their families, to deal with the issues that happen throughout the life cycle. So that's another area that's growing that you can look at and consider. A lot of social workers going into private practice. I know that's a little controversial for some in their career field, but a lot of social workers are going into private practice as well. Quick. You probably now realize that, but 60% of mental health services are provided by clinically licensed social workers. That's across the country. If you get the rest, it falls out 10% psychiatrists, 23% psychologists, 5% psychiatric nurses, probably nurse practitioners. But the vast majority of mental health services are provided by licensed social workers. That's why we at the MSW level, about half of our students are non-BSW graduates. So I kind of tell them that they see the light. They get the light after they get their criminal justice degree or their psychology degree, and they see the light that you can do so much with your MSW degree. So it opens up a lot of opportunities for you. Even in our MSW program, we get a lot of students who have another master's already. They have a master's in counseling, MBA. We have students that are joining in with a law degree like myself. They're getting a social work degree. They already have these degrees, and they're coming back to get the MSW degree because it's just that valuable. We're also, last semester, we had 2 PhDs come back to get their MSW degree. We had a PhD in aging, and she is now in the MSW program. So that shows you the value of the degrees of social work in the career field. And it's the fastest growing career field out there, the fastest growing. 16% employment growth between now and 2026, and that's faster than the average for all occupations. So you will have a job in social work. Okay, these are our programs, the Bachelor of Social Work, the Masters of Social Work. All of them are face-to-face or online for both the BSW and the MSW program. I mentioned the Substance Use Treatment minor that started this semester. We also have the Diversity Studies minor. You can also get a certificate in that. And we have the Social Welfare and Social Justice minor, which is for non-social work students to get that minor. For the BSW, we also offer those classes out at the Fort Worth campus. So if you're on that side of town, you can also take classes at Fort Worth face-to-face. And for our Masters of Social Work program, we have one of the widest variety of specialties you can choose from in the region. So we have, of course, direct practice in aging, direct practice in mental health and substance abuse, direct practice in health and health services, and you also have direct practice, of course, in children and family services. You can also go in the macro level and focus on community administrative practice. So you have a wide variety of areas to choose from when you get to your advanced year of the MSW program. And then, of course, the PhD, we have both full-time and part-time. Full-time is paid for, if you decide to come. The full-time program, if you're accepted into our full-time PhD program, it's fully funded for the first 3 to 4 years. Yeah, question?
No, I just was going to say, if you are a student that is taking a foreign language class, get fluent in it, because folks with different, especially with kids that speak Spanish or another language, we can't find folks that have this another language. And even if you pick something like, I don't know, Arabic or another language like that, because the translations services, I mean, we use them. I bet we spend thousands of dollars every month just with translation services, because there are so many folks that are here, immigrants, refugees, what have you, and I don't speak any of those languages, and so I mean, if you can get another language in there, it just adds to your value.
Catherine Sanchez, a former professor in our program, she spoke in the spring at one of our events. She mentioned if you are Spanish speaking, you speak Spanish fluently, and you get that license, MSW license, a lot of opportunities out there for you. There's a need for it, great demand for it. So, thank you. Okay. Student organizations, current students, please get involved. We have really good student organizations out there within the School of Social Work. And I believe that's it. I hope this is your calling. All right. And I will pass this back to others. Thank you.
Any questions on social work programs here at UTA? All right, so kind of the last little piece that I'm going to go through really quickly. Like I mentioned at the very beginning, I work in the Lockheed Martin Career Development Center here on campus. So I'm going to do a quick plug overview of services that you can access as a student or an alum. So let me pull up my PowerPoint. Okay, this is really quick and easy. So in the Career Development Center, we've designated kind of what we call our 5 E's, and it's the student experience that we want students to have with their programs at UTA. So the first of those is explore. So what that is when you get to UTA, kind of explore the resources that are available to you. Look for student organizations, look for resources on campus. Just start to acclimate yourself to what is available. Our second phase is engage, so actively getting involved with organizations, with research, with part-time jobs, things like that. Just start engaging with your interests. The third one we have is experience, so that's things like getting internships, doing job shadows, having informational interviews with professionals in fields that you're interested in. Getting that firsthand experience is really crucial in kind of figuring out what you want to do, and also helps you network and build your network for when you do start looking for jobs, which brings us to our 4th phase, embark. So whenever you graduate, getting a job, going to the job fair, things like that. So embarking on your kind of career journey. And our 5th and final is elevate. So once our UTA students graduate, we want them to come back as alumni and offer their time and resources to other undergraduate students, graduate students, really give their expertise back to the community. So those are our stages. And then the next slide is some of our services. So this is a really quick overview. So quick raise of hands, have any of y'all been to the Career Development Center? Or been to any events? Okay, so not many. So within the Career Development Center, it's kind of a misconception that people think they can only go there senior year when they're looking for their first full-time job, things like that. Absolutely not true. There is so much that you can do in our office. So the first thing that we have on here are workshops. So we have workshops every single week on writing resumes and cover letters. So this is taught by we call them MAV navigators. So they are students who have been trained by our career consultants in resume writing strategies, how to write cover letters, how to make them effective so that people pick you when they read them. We also have job search strategies workshops every single week. So if you're looking for a job and you're having a hard time finding something, we have strategies to help you connect and find opportunities that are meaningful to you. Additionally, we have one-on-one appointments, so you can come talk to a career consultant. You can talk to them about major exploration. So maybe you're undecided, you're trying to figure out what your major is. Talking to a career consultant on possible career outcomes is a great way to kind of narrow down what you think your interests, for a degree program will be. If you're looking for an internship, increasingly internships are things that employers are looking for during your undergrad or grad kind of career. So looking for internships, best ways to strategize that. Career exploration, you don't really know what you want to do yet. You can come talk to a career counselor and get that one-on-one advice. Same thing for career searching, if you're looking for new jobs. Anything like that. We also offer practice interviews, so if you are concerned, maybe you feel like you don't interview well, or you want to do some practice questions, you can come in and have a face-to-face interview. We also have some digital resources, so additionally, I'm going to skip down to Interview Stream, so that is an online practice interview. So it's a service where it records you, it asks you questions, you record yourself, it sends that video to a career consultant, and they will critique it and give you back that feedback. So maybe you don't have enough time to get into the office to make that one-on-one appointment. You can do that online and still get feedback in preparation for an interview. We also have Focus 2, which is our assessment service. So it is kind of a personality career assessment. It gives you some options for what your strengths are and suggested majors or careers maybe to look into. And then our final piece that I'm going to touch on is Handshake. How many of y'all have registered on Handshake? Okay, again, not many, so this is good. Handshake is our online job database. So that's where we post all of the job opportunities within UTA. So we have employers who send us job postings really regularly. So last year, just as a reference, we had almost 24,000 jobs posted on Handshake in 1 year. So Handshake is a really invaluable tool for any undergrads, grad students, alums. As an alumni, you can still access this resource, so it's something that will never go away for you. So once you get on Handshake, you just log in with your NetID and password. Immediately, you have access to over 25,000 jobs. So if you're not on Handshake, please get on Handshake so that way you can look for these opportunities. Some of them are unique to UTA students. Some of them are posted in other places, but when you're looking for part-time jobs, when you're looking for internships, when you're looking for full-time jobs, maybe you want to try to connect with people and do informational interviews. Handshake is a great place to start because it is available to you as a student, so you should take advantage of that. Another just kind of quick thing to cover is we recently started our career spot. So at the very bottom of this slide, our career spot is set up in our lobby, and those MAV navigators that I mentioned earlier who teach our workshops, they have drop-in hours. So if you have a quick question, we have drop-in hours on Mondays and Wednesdays, so you can have a quick drop-in 15-minute appointment. So if you have a really specific resume question and you want to submit it maybe for an online application that's due the next day, you can come in and get that quick feedback. You want quick feedback on maybe your LinkedIn or networking or anything like that, you can have a drop-in appointment one-on-one really quickly with someone who has been trained in those topics. Of course, we still have one-on-one appointments available with our consultants, but this is a great option if you're just looking for some really quick feedback. So that's kind of my spiel for the Career Center. I have some handouts that I'm gonna send back on each side of the row so that y'all can take some of this information with you. But that is all that I have. Lee, did you have anything you wanted to add?
I'm not too sure if you mentioned how Handshake specifically vets out the employers on there. So instead of looking on Indeed.com and not being 100% sure the employer is a valid employer, Handshake, they've been vetted. Is that true?
Yeah, so we do have all of the student workers in our office look through employer profiles to make sure that they have a legitimate website, things like that. That's not to say that every single opportunity is like 100% like a done deal. You will have the most flawless experience ever, but we do vet our employers as much as we can. All right, any questions?
sure to sign in. If you have not signed in, sign-in sheets available.
All right, let's do, oh, go
There's
ahead.
a lot of pizza left. You can take some.
Take some food. All right, let's give another round of applause for our panelists.